This video segment deals with completing the interactive complexity documentation in DocTracker progress notes. As noted in the videos which address completion of the assessment and treatment progress notes, there's a separate tab in the note which must be completed when interactive complexity is specified for a given session. What is interactive complexity? Well, it involves third-party interactions that make the session more difficult or complex. It involves sessions where communicating with the client is more difficult due to high anxiety, high levels of reactivity, or difficulty in communicating secondary to limited verbal skills. Or it involves sessions where the session is made more complex by extreme external factors, or what's known as sentinel events, such as homelessness, assault, attempted suicide, or other major events that interfere with the session and make it more complex. And the definition of a sentinel event is any unanticipated event in a healthcare setting resulting in death or serious physical or psychological injury to a patient or patients not related to the natural course of their illness. You must document the nature of a sentinel event and how and why communication was made more difficult or complex as a result in each note for each session. For additional guidelines about the criteria for interactive complexity sessions, go to the reference material and help icon on the DocTracker home screen and view the interactive complexity document under the Helpful Docs Clinical tab. So when documenting interactive complexity for an assessment progress note, begin completing the assessment progress note as described in a separate video on that topic. And if interactive complexity was in play for that session, indicate that by clicking yes on the first tab of the form down in this lower left area as shown. Doing so will insert a new tab titled Interactive Complexity as shown on the current screen. And clicking on that tab will bring up this screen. Click on the drop-down arrow and select the appropriate reason for interactive complexity from the list of options that appears. Next, you will complete the narrative text by following the instructions shown here on the screen. Interactive complexity narrative should be written to make a brief and clear statement about the justification for why there was considered to be interactive complexity, while describing the circumstances that made the session interactively complex. Also include a brief statement of how you, the clinician, were able to address the issue. And as always, proofread and spell check your narrative. Return to the Assessment Information tab of the note and complete it as usual. And no further action is required to document the interactive complexity, and you can move on to complete other documentation. And when documenting interactive complexity for a treatment progress note, the process is essentially the same as for the assessment progress note. Begin completing the note as described in the video for that topic. If you select yes for interactive complexity on the Session Information tab, an additional tab will appear, and the information requested in that tab must be completed as for the assessment note. And as you can see, this interactive complexity form is identical to that of the assessment progress note and should be completed in the same manner as described earlier in this video. Once the interactive complexity tab is complete, go on to complete the rest of the treatment note as usual, and no further action is needed to document the interactive complexity event. Continue with completing your other documentation as needed. And this concludes the presentation on completing the interactive complexity section of the treatment notes.